5, 4, 3, 2, 1.
And welcome to today's segment of The Power of Money. I'm your host, Michelle Graves, and I'm here to again.
When the logo fades into you, that's when you start talking.
Oh, okay, I just did a count. Okay, thank you. And welcome to today's segment of The Power of Money. I'm your host, Michelle Graves, affectionately known throughout the United States as the Money Lady. 36 years of handling every aspect of money, from your insurance, your personal investments, your corporate lines of credit, currency, gold, golly Moses, it's been a long story. And I'm no longer a young woman, but I'm still sharp. So again, I appreciate you listening into today's segment. And again, as always, an awesome guest. I have in the studio today for the next hour, Marquetta Colbert, who is CEO of Colbert Family Health and Wellness Center, which is headquartered in Dayton, Ohio. And one of the things I'm interested in as we move rapidly into the year 2013, can you believe it's what happened in 2012? But I want to talk about health and wellness for next year. I don't want you to start making New Year's resolutions because it's deeper than a resolution. It really is about an attitude and a deliberate, conscious decision to change your way of handling you. And for those of you that don't know, for all intents and purposes, I've made a major shift, thanks to Rachel Lewis, who is a vegan, a black woman at 86. She is gorgeous, flawless, all the above. And she told me, you want to be an alive and healthy money lady, Michelle. And I did make those changes, and I'm here to tell you that I look and feel better than I felt in my younger years. And so I wanted to bring an expert here, another African-American woman who is in the industry, knows what she's talking about, and to share her perspective and her recommendations. So sit down, tell your friends to tune in because this is good, and let's see what you are going to do for 2013 to begin to live your life like you want to live. Good day.
Thank you for having me here today. I'm very excited, Michelle. This is a great topic, and we're going to really give our listeners a lot of information today.
I want you to just lay it on.
Okay.
Just lay it on. That's why I invited you, because I need somebody who's willing to cut to the chase. You're in family practice. You know the consequences of poor health. And so where do we want to begin? Give me a little bit of background about who you are, your credentialing, and what makes you the go-to person as far as health and wellness.
Well, first, let me first tell you, I'm a family nurse practitioner. So here in Ohio, that's really come a long ways. A family nurse practitioner is a nurse who has advanced training, both medical and nursing training, can prescribe medications, can own their own practice, which I do, can also treat patients, diagnose, interpret lab results, and refer to other specialists. So
wow,
a lot of people aren't really familiar or can really understand the scope of what family nurse practitioners can do, but we are able to do a lot. And because I'm a family nurse practitioner, I treat the whole family. That's the baby all the way up to my oldest patient who's 100 years old, believe it or not.
Oh my goodness. Well, this is so fascinating when I went into that whole area of designation, because frankly, I did not know that your scope of responsibilities was so broad.
Yeah, and I'll tell you, most nurse practitioners here in Ohio currently are either working for a company or they're working for a physician in long-term care, in retail facilities. In Ohio, there are only 5 nurse practitioners who actually have their own primary care office like I do, and I'm the only African American in the state of Ohio that has their own primary care office. It really, truly was a blessing from God to be able to open up the office in collaboration
Yes.
with my collaborating physician, because in the state we do have to have a physician who collaborates with us, who sees patients at the office and is available 24 hours a day. And so I have my collaborative physician is Dr. Sherelle Applin. She's also an African American female.
Really?
And she's worked in the community, is a Christian woman, and has a great commitment to serving people just like I do and treating people like I do.
That is, you know what? This is an amazing conversation, because as this country gets increasingly more high tech, there is such a vital need for what you do.
Yeah, and one of the things that when we look at where healthcare is going, and we're going to talk about that today, where healthcare actually is going in the next couple years, really, not even real far away. 2014, with the Affordable Care Act, we'll see some changes. But one of the things that will be very important is the shortage of family physicians that will be available, that will not be available to treat patients. And so how the role of the nurse practitioner will expand, and you will see more nurse practitioners who will be able to either have their own practice or will be able to be on the front line of treating and seeing patients. So this is a great and exciting time for other nurse practitioners like myself.
So under the affordability, also known as Obamacare, will you be able to compete with doctors in terms of rates, or will your rates be better, or how will you work through that?
Yeah, that's real interesting that you say that, because when I have several physicians who are friends and really are supporters and really collaborate with me, but when they like to give me a hard time, they try, they'll say, well, what's the nurse practitioners can't compete to physicians. But one of the things that I can tell you is nurse practitioners, because we do get paid less than the physicians, and all of the research, there was a recent study that showed that when they looked at satisfaction scores from patients who had been treated by a nurse practitioner, our satisfaction scores in some areas were actually higher than a family physician. So not only can you get good care by a nurse practitioner, but it's actually going to be cheaper to the healthcare system, because we do get paid less than physicians. So what
under this current...
Well, even currently. So under commercial insurance plans, whether it's United Healthcare or any other commercial insurance, Medicare or Medicaid, we do currently get paid. Our reimbursement is at 80 to 85%, where a physician's reimbursement rate is 100%. So we do get paid less than a physician, but our quality of care, as it's been shown in research, is, if not superior, in some areas equal to, if not better than, physicians.
Well, I have to comment because, frankly, physicians are overwhelmed and inundated, and they don't have time to really get into your world. They're on a clock, and you feel like a number. And I don't care who it is. I know that they are stretched. And so many of them are now tied into hospitals for managed care as we move into that arena. And they have to see X number of people within an hour. And so they don't really have the time to do all of the detail. I will tell you this, I had a nurse practitioner last year do my physicals, my cervical, my mammogram. It was a nurse practitioner that handled all of my work, because the doctor couldn't make it right. And actually I told her, can you be my doctor forever? And she was like, oh, Michelle. But her quality of care was extraordinary. It was.
Yeah, what we really do really well is we treat the patient. So we do the medical management that a physician does, but because we are nurses first, you get that education, you get that caring.
Because she actually explained to me precisely everything she was doing. She asked me how I felt. I was so amazed. And like I said, when I asked her, when it was all said and done, and she had a number of follow-up tests she wanted me to do, because I turned 60, and there's a
Okay.
lot of things you want to make sure are okay.
Exactly.
And I was so shocked. I must tell you, I was so shocked. And then that's when I asked her, I said, can you please be my doctor? Because he's never, I mean, 5 minutes, how you doing? Da, 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 let me look at your chart. And gone. And I think that personal touch is so important today.
The personal touch is very important. And patients will tell you that no matter what insurance that they have, they want to be listened to. They want things explained. So even if it's as simple as coming in and having that cholesterol check, they want to be informed. They want to know what's
What
going
are you doing? Right.
exactly and what's going on with their body.
Well, let's talk about moving ahead and what is going on.
Okay, wonderful. So, some of the things that's really important that I think is important, even for the listeners to know, healthcare is going to preventive care.
Okay.
And that's something that's going to be real important. Preventive care, and really, what does preventive care mean, and why do I say preventive care? Preventive care is real important because right now we're seeing people go to the emergency rooms. They're using the emergency room, and like you said, you just got a physical. Well, they don't have primary care providers to go in and get that physical. So they're going to the emergency room for colds or anything that comes up. They go to the
Because
emergency
they
room.
don't have a doctor. So they go to the hospital.
For everything.
Who pays for that?
The taxpayers.
We pay for that?
We pay for that.
I do not like that.
Okay.
Okay, give me an alternative.
Okay. Well, I'll tell you, we're going to pay no matter what. So we're going to pay if a person goes to the hospital and they're utilizing the hospital and they're getting these $10,000, $20,000 MRIs. Would you rather pay for a $10,000 MRI, or would you rather pay for a $100 office visit for someone to come in preventively, have their high blood pressure checked, managed in a doctor's office, or if they don't come to a doctor's office and have that done, or in my case, a nurse practitioner office, they go to the hospital once their blood pressure's been untreated and they have a stroke, and that hospital visit is $50,000, $60,000. So which one would you rather pay for?
Well, obviously,
That doctor's visit.
I'd prefer to do my nurse practitioner first, because I
Right.
really did like her, and then followed by a reputable physician who specializes in that type of care.
Exactly.
I would have to see that, but that's not
what's occurring.
what's happening out here.
That's not what's occurring. And so, what we have to do is we have to get more people into a primary care provider,
Okay.
whether it's a nurse practitioner or a physician. And keep in mind, both can refer to a specialist. So if someone's having symptoms of a stroke, I can refer to a neurologist or a cardiologist for the heart, just like a family physician would.
This is profound, what you're sharing with me.
That stress test.
Yes.
So someone's having chest pain, I see them in the office, I do all of the workup, whether it's blood work, echocardiogram, and then refer them to get that stress test. That's going to be cheaper than if they went to the emergency room and they have had this heart attack and they're having to have everything that then has to occur then.
Well, now you're talking about state-of-the-art equipment. You're talking about a hospital and all of the underwriting requirements in that environment. So you're going to pay more.
We're going to pay more.
Yeah.
And the way we are going to pay more is all of us who are working and paying into the taxes. When people utilize the hospital and are utilizing the ER, that all of that astronomical costs the hospital has to incur. When the hospital incurs that cost, their insurance companies base their premiums on both uninsured and insured.
So the pool is twisted.
Yes, ma'am.
Do you find that uninsureds use the hospital more frequently than a person that has insurance?
Yes, they do.
Wow.
Because
even if they're underinsured, they still have Medicaid.
everyone doesn't, there are still a large percentage
Okay.
of people who have no insurance at all, who may not even qualify for Medicaid.
Oh my goodness. Okay, so they're under the radar.
Right.
And when something happens to them, they just head to the hospital.
They just head to the hospital.
Jeez.
So with the Affordable Care Act, and I don't take a position either way, what I do know is I want to get as many patients into primary care and get them into preventive care, which is exercise, diet, getting the testing done that you need to have done to prevent, you know, if it's heart attacks we're preventing, then it's checking the cholesterol and it's getting the treatment for the high blood pressure. If it's breast cancer, then it's getting my patients in and making sure they have the mammograms that they need, making sure they have the pelvic exams. My males, making sure that they're getting their blood work and they're being checked for prostate cancer.
Major.
All colon cancer by age 50, colonoscopy.
Right.
So all of these things are preventive. And I want to make sure that's done so that the cost, it's a lot cheaper in the beginning than in the end once illness has set in.
And you know, because I do so many seniors and dealing with elderly and seniors and long-term care and all of that, I was at a meeting this morning and the forecast is very, very sad. This issue of chronic care, because they didn't take care of their business, health business, when they were younger. And now the body has no choice. It's on that road. And diabetes, of course, is a major issue. You want to talk about that? What are you finding?
Well, diabetes is epidemic, which means it is just so widespread. And here in Ohio, our numbers are really, really astonishing when you look at it. Type 2 diabetics are really the class of diabetics. 90% of type 2 diabetics, we can change some of those risk factors. And when we talk about risk factors, we talk about what are the things that put them at risk of having diabetes. Obesity is one of them. I recently looked at a research article from some researchers out of the British Journal, and they were talking about how widespread obesity is really around the world. And the consumption of fast food and just not exercising, and how all of these factors have led to obesity, which is a huge risk factor for diabetes. So it's one
Although obesity is a risk factor for everything.
Exactly.
I mean, cancer,
heart disease.
Heart disease.
Yeah. Chronic pain.
Right. Your body can't carry it.
Exactly. And so with diabetes, we know obesity is a risk factor. We also know that looking at family history. So mother, father, have they had diabetes? That puts you more at risk. Smoking.
Really?
Now, Ohio is a non-smoking state. 1 out of 3 adults in Ohio smokes, which is really amazing that we have still so many people who smoke. But we know smoking is actually a factor in diabetes as well, because it does make a difference in a person healing. And also cancer makes a difference in cancer and lung cancer and colon cancer and really a lot of a variety of other cancers. But also with diabetes, it's a chronic condition that's very hard to manage. You have to tell people you got to exercise 30 minutes a day.
A must.
A must. That's a minimum. That's not even just to lose the weight. That's just to get your heart and your cardiovascular going. That's a minimum. You can't eat. You can't have sugars. You can't have bread. You can't have pasta. You got to have a little, or at least it needs to be a minimum amount.
Yes.
So it's real hard to tell people these are all the things that you can't do. And then people are like, well, what can I do?
Well, you can eat like you want to live.
Right.
You can eat lots of green, dark veggies.
Right.
You can stay away from highly processed food.
Exactly.
Which isn't a food. I don't know what it is. It's a creation in a lab.
I tell patients anytime you have something in a box that can live on your shelf for 6 months.
Oh my God.
Then you know you shouldn't put it in your body.
Oh my God. Or even worse, when you flip the ingredient list and you can't pronounce the words, you need not put that inside of your body. That is so very, very... So what do you recommend? Because my diet, frankly, is almost entirely plant-based.
Okay.
I drink a lot of alkaline water.
Okay.
I exercise. At 61, I got to play it tight. And, you know, I think I'm doing pretty good.
Yes, you are.
But I'm going to keep it that way because I look at my peers. And I was at an event not too long ago, and there were several women there that were quite large. And you know, they roll their eyes at you, and you're like, come on, you need to lose weight. And then one of the women, and I hadn't said anything, but she said, you know, trying to get this weight off is so hard. And I said to her, well, maybe you should get off of meat and maybe just do plants and green stuff. Because, you know, African Americans, our grandparents cooked sweet potatoes, greens, mustard, spinach. We ate a lot of that stuff.
Oh, yeah.
And we did not eat all of the gunky, gooey, crazy stuff that's so much a part of this. Do you think diet is a contributor?
Diet is a big contributor, and really we live in such a stressful environment now that for, you know, if you think of the time, you know, a lot of times we just have to make the time. People will say, well, they just don't have time anymore, and so they had to grab something fast food to go. And so if it's almost going back, my grandmother is 96, she'll be 97.
Oh, God bless you.
And she's on less than 5 medications.
That's even better.
Yeah.
So what are her conditions at 96?
She has dementia.
Okay.
And that's
early onset?
Early onset,
Okay.
and that's really about it. She has no cholesterol problems.
Okay.
She's not on any cholesterol medicine or high blood pressure medicine. She is on a diabetic pill.
What, with metformin?
Yeah,
okay.
Glyceride, which is similar to it.
Okay.
But she's been on that pill since she was 75.
Oh.
And it has not increased, nor is she on insulin.
Oh, well, then she's handling her stuff.
Very well.
Does she exercise or do anything physical at her age?
At this point, she can't anymore because she had fallen and she's in a wheelchair, so she can't.
Okay.
But several of the things, and actually I have 2 grandmothers living, and they both have always believed in vegetables.
Wonderful.
Vegetables.
Fresh.
You get the vegetables from the market.
Yes.
If it's green beans, you're picking them.
Yes.
And then you're boiling them. If it's greens, you're not putting the fat back and all. You're putting turkey.
Yeah.
And you're seasoning it with natural seasonings.
Right.
Garlic, pepper.
Right.
Things of that nature.
Right.
Not salt. And so both my grandmothers, to this day, that's how they
96 years old.
Yeah.
That is.
She's
powerful.
always been active. Whether it was exercising through walking or, you know, I have a picture of her when she was about 85 on a treadmill at my house.
Oh my goodness gracious.
And I still have that picture up. So I know exercise and diet is key. And I know the diet, like you said, vegetables. Fresh vegetables. Not the preservatives.
Right, and certainly not canned. I tell people, are you kidding me?
Right.
What do you think a vegetable is going to do in a dark environment with tin?
Exactly. And the preservatives that they put in there to keep it in there.
Exactly.
So I know that is the key to any prevention of any disease that we're trying to prevent, whether it's cancer or whether it's diabetes. But then it's also looking at some of the other life things that we can change, minimizing our stress.
How do you minimize stress, particularly this time of the year? Because we're now looking at Christmas, New Year's, and lots of things start happening with family dynamics.
Yeah, this is a very high time for depression and mental illness. And so really being able to develop good coping stress techniques.
Okay, which would be?
Which would be meditation, prayer, reading. How many times have you turned off the television and you just read a book, whether it was something that was inspirational or something that was spiritual or just something that, a puzzle that would enrich your mind, make your mind process a little bit faster.
Right.
So just turning off the phones, turning off the television, and just using that quiet time to be able to rest and re-energize and kind of think of ways, okay, I have this problem and this is what I'm going to do to be able to solve this problem.
That's very powerful.
Yeah, procrastination. This is a time where we have to think about, okay, setting down a plan, even if we have to write it down and have some set pointers of things that we need to take care of. When we clutter our life, we bring on more stress. So,
So declutter.
declutter, huge.
Huge.
Yeah.
And why is it, and maybe you know as a nurse practitioner, why is it that the older people get, the more they accumulate? What is that about? Is that about a fear of losing things? But what is that really about?
For a lot of them, it's generational.
Okay.
If you think of our older family members and older people, they came up through the Depression.
Ah, got it. Yeah, yeah.
So a lot of it is they revert back to their early years, and
Okay.
and you know, they didn't have as much as we have, and so a lot of it is just being able to hold on to what they do have.
Because I tell you, one of the challenges is when you're trying to move them from their place of residence to a assisted living or even an apartment, and they literally, it's the most pained experience. I don't even like to do it, because let somebody else do it, because they want to hold on to things that have no value.
Right.
But it's all about what's going on inside of their head.
And that maybe, and in their mind, that's all they have left.
I got it. It's always trauma. Always. I mean, like, do I have to? And you're like, those are at the thrift store for 10 cents. Okay? It's just no value, but yet contextually, it's very important. So since I can't be 90 at my age, at 60-ish, moving forward, what would you say for people in my generation we need to begin to do as you look at your clientele?
People in your generation, I really believe that start looking at it, and sometimes it kind of sounds, it's scary for people, but start looking at advanced directives now.
I couldn't agree with you more.
If not starting earlier.
Yes.
You know, I mean, you know, if I can share, I had cancer in my 20s.
Okay.
And when I got married, I was early 20s when I got married. I've been married 17 years now.
Oh, wow.
Wonderful husband.
Yes.
And I was very grateful that me and my husband, after we got married, we sat down and we really did advance directives with an attorney.
Oh, good.
And
that is highly unusual.
Very unusual. We did that, and we started.
You have an exceptional husband.
I do. And we looked at life insurance.
Okay, that's even better. You're making me happy.
Exactly.
Okay.
And who would have known that within 5 or 6 years after doing that, I would have been diagnosed with cancer.
And would have been uninsurable.
Exactly. So I tell people, start that so as early as possible. It doesn't, you know, a lot of times people are afraid to talk about advanced directives and what that means, and people will say, well, I don't want to, and for our listener, our viewers who don't know what advanced directive is, it's really just putting in place of your healthcare decisions.
Exactly.
So would you want to, if you were incapacitated, would you want to have CPR? Would you want to be on a ventilator? Where would you want your finances or anything that you have? Who would you want it to go to? And who would you want to make those healthcare decisions for you? Putting that down in writing. So if anything was to happen, whether it's a cancer diagnosis or it's a sudden motor vehicle accident, it's in writing on who you would want to make those decisions and what your decisions would be.
That's so very, very powerful. And I say this because at the point, my practice, of course, is restricted to retirees, pre-retirees, people 50 and over. And that's a hard thing to explain to people, that the older you get, the more the probability of stuff gonna start happening, which makes you uninsurable in so many cases, particularly on diabetes. That's why the insurance industry knows this is a major debilitating disease. It has an end point. It does.
It does.
It has an end point, and it's not such a good end point. So I have to applaud you and your husband for being forward thinkers and forward planners to save your family the sorrow.
Right.
And it is sorrow when your affairs are not in order.
No, and I unfortunately see so many young people, you know, 30 years old being diagnosed with colon cancer, 18 years old being diagnosed with breast cancer. 20 years ago, you didn't hear about this. We didn't think of colon cancer in a 30-year-old. That's why the
No.
guideline says check colon cancer, baseline colonoscopy at 50.
Right, right. I had mine at 50.
Okay.
I was fine.
Good, wonderful.
fine.
I had
No.
mine last year.
Okay.
So I had it earlier. I had it at
Okay,
40.
that's okay. That's
but
all right.
30-year-old being diagnosed with colon cancer.
What was his lifestyle? What was he eating? What?
Just the normal
Junk food.
But there's so many environmental factors as well.
Oh God.
Because we know that a lot of the produce and meats nowadays they're putting hormones
Yeah.
and pesticides
Yes.
in stuff. So a lot of it is diet, but there's a lot of environmental factors that researchers still haven't figured out.
I know, and cancer is so complex to try to do a simple diagnosis. But I must say, I have never seen so many people sick.
Right.
Ms. Colbert, I have not ever in my 60+ years, all the medications, you look at a senior, 25 medications? Are you serious?
Right.
How are you going to live through this?
Right. And we're living longer. We're actually...
That's good.
It's good.
But it's bad.
But it's bad.
You're living longer.
We're living longer. The average age now is we're living to at least 76.
Yes.
But we're living in chronic pain and
Right.
disability. The last 14 years of our life, in many cases, chronic pain and disability. So what quality of life?
Well, that's my whole thing, which is don't tell me I'm going to live longer if I got to live like that.
Exactly.
And I really do mean it. I don't see aging as being a good thing if you are always hurting.
Exactly.
I mean, I cut my little leg a week or so ago, and I'm kind of limping around. And I'm like, there are people whose entire bodies feel like this and need help, need drugs, need everything,
Right.
and cannot seem to get any answers. They
Yeah.
cannot, because what is that, soft tissue? You don't know what it comes from.
Right. Yeah. And there's just there's more infections. There are a variety of infections that we just are widespread now.
Yes.
So even something as simple as cutting your leg, can turn into bacterial infection.
Staph.
Right. Right.
Right, I'm keeping a real close eye on that. I absolutely am, because those are areas that are of great concern to me. And that
Okay.
issue of airborne pathogens and bacteria, and just being around people that are unhealthy. I was at an affair Saturday night. I had forgotten that people still smoke cigarettes.
Okay.
I don't know anybody around me that smokes cigarettes, but I was at an older event,
Okay.
and I was with a friend of mine who I love dearly, and she's a cancer survivor, bless God.
Okay.
And they were all smoking, and we were like, Pink Panther, stage left, and the room was full of smoke.
Yeah.
And I was literally doing this to myself, which is, oh my God, I got to get out of here. And she was like, oh no. But that is, and I understand addiction.
Okay.
And obviously, if you're smoking cigarettes, you're an addict.
Right.
But at what point do you take responsibility for changing your lifestyle decision?
Right. And for some people,
They just can't.
They can't. And I do have patients who will tell me, I know I may die because of the cigarettes. I may have an oxygen tank hooked up to me, but I'm willing to make that choice.
Wow.
Yeah. Because my patients know, I tell them just like it is.
Oh no, you must tell a person that's a smoker that not only are you heading down that road, but you may be bringing a bunch of other people with you as well.
Right.
Because secondhand smoke is really a problem.
It is.
I mean, I just, like I said, I understand it's an addiction. I understand it's like alcoholism. Well, they say that's a disease, but I think it's an addiction. And other forms of drug use. These are they're food addicts. But when you start talking about shortening the days of your life,
Right.
and then the chronic pain
Right.
and illness,
Right.
I don't know how a mature adult can make those kind of decisions.
Right. And is it truly worth it?
Is it worth it for
Right.
your family
Right.
and for you to live out your days like that. That's hard for me to understand. How are your young people doing? Are they getting it? Are they organic? Are they going green?
My young people are getting it in so many ways. We have seen smoking go down in the adolescents.
Yay, good.
So smoking has gone down in the adolescent population, which is wonderful. There are other concerns with the adolescent population. So with teenagers, whether it's dealing with a lot of the attention deficit, some of the mental health, behavioral concerns. There's still a big factor in infectious diseases, and so HIV prevention and other sexually transmitted infections, of course.
Are you seeing a backup off of that? Are young people beginning to take control of their sexuality?
They're still, it's that population, still, they think they're invisible. They still think, oh, it's...
Not going to happen to me.
Right. And
wow.
So I can't, I can't say that it's completely changed. There's, to be honest with you, there's not enough. We need more providers, more nurse practitioners working with adolescents and children, and more physicians, family practice who want to work with that population. We need more.
Wow.
There's not enough who are willing. It's a challenging age group. And
and
they have so many different, you have to be able to reach them at their level, and they have so many different factors that they're dealing with that's completely different than your adult or your older adult. So I think those are some of the biggest issues. And then again, of course, we've seen in the news just whether it's gun violence, and there's still a lot of violence against each other through fighting, and so that, believe it or not, all of that is still a part of health.
Of course, mental health.
Oh yeah,
is the quiet epidemic.
Exactly.
The number of children that are dysfunctional and are actually scary.
Right.
I mean, really, because they got those hormones going, and they got a lot of stuff going, trying to sort out life.
Have grown up in dysfunctional homes.
Yes.
Not really having mentors, and the lack of male role models, especially in minority communities, has really, really hit our families hard.
I know it has.
And has made a difference in these young people growing up and being able to express their anger in a healthy
way.
In a healthy way.
Because I look at that Sandy Hook situation that we're all still grieving about, because it was so horrible. But it was a young man, and he did seem to have indications that things were not exactly okay.
Right.
And he cracked and he snapped.
Right.
But how many other young people, as we look at the carnage, and they just inability to cope?
And in recent years, we've had here locally, we've had several young people who have committed suicide.
Really?
Yeah.
They put a gun to their head?
Either through putting a gun through their head, jumping off a bridge, hanging.
Hanging.
Yeah, there's cases that we know about that don't necessarily, you may have known the family or knew someone and knew the family that you don't hear in the news.
And they hung themselves.
Depression.
Bathroom?
Closet. Depression.
Ooh.
So that's a real challenge for those of us that are health providers, and we see people who are suffering from depression, dealing with anger issues, and just working with the families, working with the dynamics of the families to recognize these symptoms, get the proper treatment, realize that it's okay to talk about it.
It is okay to talk about it.
We can hide, that we actually have to talk about it so that we can get these young people the treatment that they need before they snap or something occurs.
Well, I was watching last night, interestingly enough, that you bring that up, a lady did a blog about her trials with her son, 13, who has mental illness. And the response was not good. People were like, you need to be more compassionate, you need to be more in this. Because she was basically saying, my son is driving me crazy. And he tried to stab me, and, I try to hear him and feel him. And she said the system doesn't allow for that type of intervention.
Right.
without it becoming criminal. The child has to actually do something to hurt himself or to hurt you before you can engage the court system.
Right.
And that, in my opinion, is not an appropriate response. You don't want your child to go to jail.
Right. And I hear that a lot.
Really?
Oh yeah. I have grandparents who are taking care of their children. That's something that's very common now. Grandparents, whole nother generation that they're having to raise.
A grandparent is not capable of dealing with an out of control teenager.
That's the norm today.
That's the norm.
That is the norm. That is the norm. Either the father just is not there, the mother's on drugs, the mother's, or just working and can't handle it. For whatever reason, the norm is the grandparent raising another generation.
And may I assume, because of the issue of mortality, that it's probably the widow grandmother?
In a lot of cases.
That's having to raise these children?
Raise the children. And I can't tell you, I can tell you just in the last 6 months, I've had 2 families in my practice where one grandmother, she came in multiple times saying, I've been talking to the judge about my grandson. He's telling me he's going to kill me. He's showing a knife at me.
No.
I'm taking him to the psychiatrist, and they're just not listening. Another grandmother whose grandson also was threatening to harm her and has harmed others in the family. So I mean, this is what I hear on a regular basis.
I'm just done. But our time is closing up, and I need you first to give your telephone number.
Okay.
Could you please, and say it distinct and clear, and say it twice.
Sure. My telephone number is 937-529-4376. Again, it's 937-529-4376. And I am at 2580 Shiloh Springs, Suite B in Trotwood, Ohio, 45426. I am accepting new patients. And again, my practice is Colbert Family Health and Wellness at 2580 Shiloh Springs, Trotwood, Ohio.
And guess what I'm going to do? I'm going to come on, and I'm coming up the road and let you do my physical this year.
Well, I would love to take
I'm going to do that.
Wonderful.
I think I like your candor, I like your transparency, and I like your love.
Wonderful. I'll take great care of you.
I know you
just
will.
Just like I do my other patients.
No,
so.
I have every confidence that you will take very good care of me. That shows very clearly in your spirit, and I love that about you. And I think that what you're bringing to this community is awesome. I really do, and I want to encourage you to continue, because 2013 is going to be a major year. It's on so many levels, not just in terms of the finances of our country, but I think we're now dealing with aggregates where more and more people are sick, more and more people are confronted with, do I want to change my lifestyle, my eating, my behaviors, or do I want to be sick the rest of my life?
Right.
And that is a hard choice. For many, I'm not going to oversimplify that. That's a tough decision. But you are to be committed. May I shake your hand?
Oh, well, thank you.
I just thank you so much for being a blessing in this time in history. Well, I really do.
Well, I appreciate you having me on the program, and I just thank God for the blessings that He's bestowed on me so that I can provide the highest quality to my patients.
That's wonderful. Viewers, you heard it from me, and you just saw it for yourself, this awesome woman, a nurse practitioner, and hopefully I'm going to be one of her clients, because I like people that love. I like people that are not on a clock and can take care of my business. I'm at an age now where, as I tell folks, I have to talk to myself in the morning, like, get up, Michelle, move your leg. And I want to make sure that my older years are awesome. And I've made some decisions to take control of my life on so many levels, because I don't want to be alive and suffering. That's not the story that I believe God has for any of us. But I want to thank you for joining today's segment of The Power of Money. I appreciate your listening and taking notes. And by all means, patronize this remarkable woman. And until next time, as I always say, God bless you richly, and you take care. See you soon.